we are glad to have Dr. Karthikeyan sir. Sir, on behalf of Bharat University, I welcome you to this international conference. So, your topic of your presentation is strategies and avenues suggested in the treatment of COVID-19 infected patients, pharmacological, genetic, immunological, herbal, and other drug delivery systems. Dr. Karthikeyan, professor from University of Madras Pharmacology Department. Thank you, sir, for your presence. Please go ahead, sir. Sir, you can
Audible,
start, sir.
Anka, sir?
Yes, sir.
Audible
Audible,
now?
sir. Yes, sir. You can start,
Okay.
sir.
Okay. The slide is not there on the screen.
Yeah. She's come.
Yeah.
She's going to upload. You can start, sir.
Okay. Okay. Now, sorry for the interruption. This beginning it will be like that only. So now I am before you for delivering the. Is it audible now?
Yes, sir.
Strategies and avenues suggested treatment of COVID-19 infected patients, pharmacological, genetic, immunological, herbal, and other drug delivery recommendations. And this is being delivered by me. I am Prof.Dr.S.Karthikeyan, who is retired professor from University of Madras, Department of Pharmacology and Environmental Toxicology, Dr. ALM postgraduate in Taramani campus, Chennai. Now, COVID-19 is now the hot topic throughout the world, and several lakhs of people are suffering every day. And now it has been very clearly brought out to the notice of the world that it has originated from the Wuhan district, China, and it was hello.
Yes, sir. It's audible.
It's
Okay, it
audible.
was
Please
started
go ahead.
from the COVID-19 was declared as pandemic by WHO some 3 months back, and initially this disease was called as a novel coronavirus 2019 or 2019 NCOV by WHO and was renamed as severe acute respiratory syndrome coronavirus SARS-CoV-2 by the International Committee of Coronavirus. The disease is presently called as coronavirus disease 2019 or COVID-19 shortly. The 19 stands for the year in which it was started. It was in November 2019, so it is called as COVID-19. The word CO refers to the corona, P refers to the virus, and VI refers to the virus, and P stands for the disease. So that is how the word COVID has originated. And SARS-CoV-2 highly contagious disease, and it has been proved beyond doubt that it spreads from human to human. And here I have given the structure of the appearance of the COVID-2 virus under the scanning electron microscope, sorry, the transmission electron microscope image, and to see that SARS-CoV-2 is having an envelope and a positive sense and a single stranded retrovirus, otherwise called as a RNA virus, and its RNA is 29.9 kb beta coronavirus. SARS-CoV-2 genome has been proved that it is having 88% similarity with the bat species, bat SLCoV ZC45 and bat SLCoV ZXC21. RNA sequence is almost 96.2% similar or identical to that COVID RATG30. So, by all the means, it is possible to think that it has emerged from bats. But there are several opinions about it. Let us not go into the detail about it because it's not our topic of concern today. But here we see that the corona has got certain characteristics. COVA is a single stranded RNA virus and it has got a spike glycoprotein in the envelope and it gives a crown like structure or crown like appearance. That is why it is called as corona. The subfamily of orthocoronavirinae has 4 genera and it has got alpha, beta, gamma, and delta coronavirus. Furthermore, the genus beta coronavirus divided into 5 subgenera or lineages. Bat and rodents are considered to be the genetic sources of alpha and beta coronavirus. The avian species also has got coronavirus, but they belong to the delta and gamma coronavirus species. And this is the graphical representation of the coronavirus. And now, if you look into the outer characteristics, why I'm giving you this is very important in the drug development and also in understanding the mechanism of drug action. So kindly, for the time being, you remember that there are four different types of proteins that are present in the viral protein, which are called as a viral protein. The S protein, M protein, M protein, N protein, and E protein. S refers to the spike protein, or which is on the surface of the, which is also the surface protein, and you can see that the crown-like structure is having this S protein. And the other important protein is a membrane protein, which is a very thin membranous protein. And of course, in the nucleus capsid also, there is a protein which is helpful in binding the RNA, and there are also envelope. Now, all these four proteins have got different characteristics and line of sequence. Here I have also shown the viral genome, which is having two different open reading frames, which is coding for the RNA, which is for the multiplication. Open reading frame 1A and 1B, and open reading frame 2 is also there. Of course, there are also the RNA sequences which are having which are dedicated for the production of the S, M, N, and E. So this is how the local organization, or this has been too beyond of these structures are there, and we should understand that the S protein or the surface protein is very important for the growth and development. We will see how it is having an impact with disease progression and also in pharmacology aspect of prevention or therapeutic measures. Now, the clinical features of COVID-19 are plenty. There are lots of clinical reports, and the signs and symptoms are multivarious. It varies from person to person, but commonly it starts with fever and cough, and there is fatigueness, shortness of breath, expectoration, neuralgia, rhinorrhea, sore throat, chest pain, diarrhea, vomiting, loss of smell, and loss of taste. There is also onset of respiratory syndrome. It is very, very dangerous onset because it should not get deepened as a days progress in the corona infection. And there is discoloration of fingers and toes. People has reported that. And there is viral conjunctivitis. There is confusion, skin rashes formation, and cytokine storm is a very important laboratory investigation. I'm telling it here because it has got some impact the drug development. We will see it later. And RNA anemia, there is a lot of RNA synthesis, which is also a laboratory. These are all some of the common symptoms of sickle. But clinically, the COVID patients have been broadly classified under four different categories: the mild COVID-19, moderate COVID-19, severe COVID-19, and critical COVID-19. This is what is a broad clinical classification of the features of COVID-19. What is mild in corona COVID-19 is they have a very low grade of fever, somewhere around 99 degrees to 100 degrees. They develop cough and rhinorrhea, sore throat is there, and there is nausea. Some people develop vomiting, and there is also report of development of diarrhea between 20 to 30% of persons, and it is without any radiological feature. That means the lung functions are all normal. There will not be any presence of nodules or pneumonia-like symptoms when we run radiograph. And this is with respect to the mild. Moderate means the fever is very intense and it continues and non-stop for several days. Maybe starting from day 1, it to day 7 or day 8, and the temperature is non-stop. It is from 99 degrees to 101.5 degrees like that. And the respiratory symptoms also is there. They develop very cough and shortness of breath. Some people develop, and it is having some radiological severe coronavirus infection, dyspnea, that is loss of the breathing, temporary loss of breathing, and there is inconsistent breathing. Respiratory frequency falls below 30 minutes, 30 numbers per minute, and blood oxygen saturation level is below 93%. This can be monitored by using steam oximeter and blood oximeter, and the lung infiltration are more than 50%. Critical COVID is very, very severe, and it develops nearly 7 days after the patient is fully infected with COVID. And it may be um, associated in patients who are having mild, moderate, or severe. So that means the mild patient has got all the mild COVID infected patients may be developing the severe or critical stages depending upon their physical condition. And they develop acute respiratory distress syndrome, or otherwise the ARDS, and they require mechanical ventilation all along the presence of the and they develop the multi-organ function or failure. And this is very, very dangerous, and this increases the mortality. So critical COVID is the concern. Now, depending upon the varieties of symptoms, the symptoms may also be classified as asymptomatic or symptomatic. Now, many patients in India as well as abroad develop the coronavirus infection without much of symptoms. And they'll be having only mild diarrhea, gastrointestinal problems, abdominal pain. But in severe critical cases, people reports about the breathlessness or the sun. So asymptomatic patients are very, very common, and they are supposed to be the carriers of the disease. They themselves don't know that they are having the disease. And in addition, they spread the disease to other persons also. Now, as far as the clinical concern, we have discussed about it, how it is behaving. In the laboratory investigation, several clinical chemistry parameters are altered. For example, biochemical parameters like the lactate dehydrogenase, that is LDH, aspartate aminotransferase or IAST, alanine transaminase, ALT, creatinine kinase, and C-reactive protein, erythrocyte ESR, erythrocyte sedimentation rate, and white blood cells are also increased. Urea and creatinine content also is highly increased. And the blood hemoglobin level and hemocyte count, eosinophil, serum albumin levels all decreased. And very importantly, in severe cases, there is increased inflammatory markers like interleukin 1, and about this we will discuss later, IL-4, IL-10, and tumor necrosis factors are also there. Now here in the next slide, there is clinical features have been reported by WHO, the symptoms, also the possible complications. If there is headache, body will be having fever and other things. This is of course a repetition of what I was already talking about. And one thing to be remembered in this is the development of severe acute pneumonia. The patient should not go in for this at this stage. There is a general feeling of fatigueness, exhaustion, and the patient will not be able to talk or breathe properly. And there is cough and there is sore throat followed by that. The patient has to be put on ventilation for therapy or management of the lung function. Next slide, please. Okay. So all these things are the manifestations, clinical manifestations, laboratory investigations of the disease. People may be asking how this COVID is infecting humans. These are very, very important aspects to be considered for drug development and also for from the treatment. So this is here I have given a picturesque
It's
presentation
fine.
or the schematic presentation of SARS-CoV-5 and how the course can change. I told you just now that there are spike proteins, membrane proteins, envelope proteins. Now these spike proteins are very, very important, or the crown of the coronavirus, very important, binding itself to the surface receptor, which is called as the ACE receptor. We will come to this the next aspect of what is ACE receptor. So there is a binding of the coronavirus with the receptor of the host cell. The host cell may be the lung tissues or any other cell. So the coronavirus goes often attaches itself with the ACE receptor that is present on the cell membrane. So once it is attached, it is simply being taken up by the host cell and it finds a very easy entry into the host cell. So the spike proteins are very, very important in the intake of in entry of the coronavirus cell membrane. Once it goes into the cell membrane, starts developing, we will say about it later. But what is the interaction with respect to the ACE2 receptor? For this, we have to understand the functionality of the ACE2 receptor. Next slide, please. Now, next slide.
Yes, sir. 1 second, sir. It's not moving. Yes, sir. So next slide came, sir.
Sir, Dr. Karthikeyan, sir. Dr. Karthikeyan, sir.
Now,
Yes, sir. You can talk now, sir. Next slide is there.
I am talking. Somebody, I think there is interruption.
Yes, sir. You can continue now, sir.
Okay, I'm not getting connected. Okay, right. Starting video once again. And, okay. Shall I start now?
Yes, sir.
I don't know. Something has happened in now. There are two split images, one on the left and on the right. Let us now concentrate on the left to understand about angiotensin. Now, angiotensin is a very, very important protein that is helpful in the maintenance of blood pressure and also in the sustenance of the membrane or the reticular endothelial cells. It is present especially in almost all the cells. Now, the angiotensin is formed from a precursor protein which is called as angiotensinogen and it is produced in the liver. Angiotensinogen, in the presence of another protein which is called as renin, which is produced by kidney, both of them join together by some chemical reaction and they convert and it is converted into angiotensinogen is converted into angiotensin 1 protein. Angiotensin 1 protein is converted into angiotensin 2 by another enzymatic reaction, which is called as the angiotensin is converted into A2. Angiotensin 2 joins with the receptor, which is called as the angiotensin converting enzyme 2 receptor, which is present on the cell membrane. I've given it as ACE2. You can see on the cell membrane. So ACE2, when it is attached with the angiotensin, it starts producing angiotensin 1 to 7 proteins sequentially, and they are absorbed in the by the cell membrane, and this is responsible for production of GPGR, that is several glycoproteins, which subsequently go in for the production of lot of chemicals which are responsible for protecting of the cells inside the cytoplasm. So the presence of ACE2 or the angiotensin converting enzyme 2 is very important in cellular maintenance, and this maintenance is very much essential for maintaining the body temperature, the blood pressure, and also this one. And for particular pressure. Now, on the right side, we see SARS coronavirus infection. The coronavirus goes and attaches to the ACE2 enzyme that is present on the cell surface. So when it is attached to the spike protein, it starts entering into the cell. So what happens is, because this ACE2 is being blocked and it is not able to act with the angiotensin 2, the angiotensin 2 protein starts sitting on another type of protein or a receptor, which is called as angiotensin 1 receptor. So when the angiotensin 1 receptor activity is initiated, now what happens is that it starts producing pro-inflammatory signals. Pro-inflammatory signals, we will talk about the signals later. And there is also synthesis of lot of pro-inflammatory and the cytokines, and it causes the organ damage, hypertension, and cardiovascular diseases. So this is how the SARS-CoV virus starts entering into the cells. In the next slide, this is the explanation I have given here. When SARS-CoV virus started to attach itself to the ACE2 receptor, angiotensin 1-1E7 is no longer synthesized, and angiotensin 2 production protein is accumulated. And this protein causes flooding and causes binding with the AT1 or receptor or angiotensin 1 receptor. And this results in the synthesis of cytokines. This is what we treat as a cytokine storm, and several pro-inflammatory mediators, and this causes the very high increase in the inflammation. So ACE2 proteins are present on the surface of the lung alveolar epithelial cells and allows the infection. Next slide. So it can be hypothesized that the ACE2 receptor levels correlate with the susceptibility of this. Now here there is multiplication of COVID mRNA, the host cell. So you see that the COVID goes and attaches with the dendrite, and it is sitting on the ACE2 receptor, and by fusion it is taken into the intracellular cells, and the genomic DNA is released, and it sits on the goes into the process of RNA replication and translation. Several mRNAs are responsible for this, for the production of S protein, M protein, etc. And proteins are synthesized, and they are being assembled in the rough endoplasmic reticulum. And assembly and budding happens in the endoplasmic reticulum. And Golgi apparatus is also playing a very important role in binding of the outer protein with the newly synthesized RNA. And finally, what happens is the freshly reproduced or freshly formed COVID viruses with the fresh mRNA lead by the process of exotization into the exodus fluid, and this comes out through the fluids that is being synthesized in the nasal cavity or in the trachea. So when more and more amount of the numbers of COVID start multiplying in the lung cavity, it starts using more and more amount of COVID infection. So the infection starts spreading because of the attachment of COVID-19 with the AC receptor that is present on the lung. Next slide. So after AC2 binding to the S protein facilitation, SARS-CoV-2 starts releasing its RNA to the host cell. The viral genomic RNA is later translated into viral replicase polyprotein and are cleaved into small products by viral bases. Polymerase enzymes produce a series of subgenomic mRNAs by discontinuous transcription and finally translated into relevant viral proteins. The viral proteins and the genomic RNA are subsequently assembled into the virons in the endoplasmic reticulum and in the Golgi apparatus, and then transported via the vesicles and released out of the cells as fresh COVID um, um, viruses. Next slide, please. Here also the same thing I have given. So the SARS-CoV virus enter into the human through the human nose as tiny droplets and get deposited in the um, nasal cavity and also in the buccal cavity and slowly descends into the trachea, reach the lung, where inside the lung alveoli starts multiplication. And the process of multiplication I have given here, and it happens because of its attachment to ACE. Next slide. Right. Now, what about the COVID in the children? Children with COVID have mild symptoms and better clinical outcomes. Children under 1 age to be higher risk of severe form of disease. Study studies have shown that children with COVID-19 are less likely to develop severe symptoms. But later, now it is understood that children are also equally prone like adults. Now, the COVID infection has got a lot of risk factors. The major risk factor for severe diseases are age of more than 60 years. That is, the risk increases with increasing age. The underlying non-communicable diseases also play a very important role. If the person of over 70 years or 60 years are having non-communicable diseases, the possibility of mortality and morbidity, diabetes, hypertension, cardiac diseases, chronic lung diseases, cerebrovascular diseases, chronic kidney diseases, immune suppression, and cancer are very important precipitating factors for increasing the risk. If the diabetes is very high, the persons who are affected by COVID are also having very high risk than hypertension, cardiac ailment. Next slide, please. The best way to detect the COVID infection is RT-PCR testing, gene sequencing. Here I have given a small image to show how the sample is being taken, and the RNA is extracted from the sample of the nasal cavity or the nasal swab, and it is being transcribed by reverse transcriptase, and polymerase chain reaction is activated, and there are two graphs you can see, one showing as positive, you can see sigmoidal curve there, and if the sigmoidal curve is being shown by the PCR mission, then the person is considered to be having a positivity.
मत
That
करो
there
ना
is growth development. Next one is if there is no sigmoidal graph or sigmoidal curve or no plotting, then the person is considered as negative. That means swab is not having the disease or the cell. So the RT-PCR is a very highly sensitive method of this one, and it is the golden standard now presently available. There is no other standard available for this. Even the antibody detection are all not good for. So there are of course there are also possibility of developing the false positive or false negative reports, and let us don't go into those details. There are possibility of this one. So depending upon the days of infection, the percentage of COVID detection, especially they are being detected 90% within day 1 to day 3 of the symptom development. There is definitely a possibility of infection and of course positive. Right? So far, we have been discussing about what is coronavirus, how it looks, how it is interacting, how it is the disease, and how the disease can be treated. So this gives you a brief idea about the methods and fundamentals about the coronavirus, etc. Now we are actually entering into the therapeutic aspects of the coronavirus. In case of corona infection, how the patient ought to be treated, especially I'm not talking about the clinical aspect, but I'm going to give you about the pharmacological or the therapeutic aspect of how cartridges are being trained for treatment. So the therapy is mostly symptomatic and it depends upon the severity process of the problem, whether it is mild, moderate, severe, or critical condition. So it is the discretion of the physician who is treating the patient, and he has to identify whether it is asymptomatic patient or how long the quarantine has to be maintained, and whether it is mild or moderate, etc. So it is left with the discretion of um, the doctors who are treating. But generally, the treatment options are based on applications of the therapeutical agents or the drugs, and genomic RNA or viral protein production inhibiting drugs, or they can also go in for immune therapy or vaccine therapy. Plasma therapy is next alternative. And herbal or traditional medicine remedies are there. And most importantly, the abatement of infection is also a part of the treatment therapy. So pharmacological, genetic, immunological, plasma therapy are four fundamental. The pharmacological agents commonly used is, we are going to see how the pharmacological agents are acting, why they should be employed, and why they should not be. Now, the paracetamol is the most commonly used drug for the relief from the fever, and it is administered at an interval of every 4 to 6 hours, depending upon the status of the fever, whether it is mild fever or severe fever. Normally, the fever is mild, starts from 99.4, goes up to 105. It is treated as mild fever, and it can be managed at home, and we need not go to the hospitals for treatment. Now, because and the paracetamol IV injection preferred if the fever is non-stop and if it is sustained. That means as long as the paracetamol is acting, the person may be having lesser fever, maybe around 99 degrees, but not completely recovered to normalcy. And once again, if the fever is not there, if the fever starts increasing to 101.5 or something like that. If that happens, the person has to be hospitalized and IV paracetamol has to be given. And other antipyretic agents should not be recommended. There are also other antipyretic agents available which should not be given because it produces severe forms of inflammatory reaction. For example, methylic acid is there, and also the diclofenac also prevent body pain and inflammation. All these are not recommended. Ibuprofen can also be suggested. It was suggested earlier, but now it has been banned, and people and the physicians very strongly suggest that ibuprofen and the other antipyretic agents not be used because it increases the severity of the disease due course. Paracetamol is very effective in management of mild or moderate COVID. Azithromycin is suggested at a 400 to 500 milligrams twice or thrice daily if there is sore throat, and it is given as a course for 5 days. And now the hydroxychloroquine and chloroquine are used for the treatment of COVID-19 infection to reduce the viral load and also to prevent the other complications associated with the COVID clinical manifestation. Very recently, it has been found that the corticosteroids, when given at very low doses, is reported to reduce mortality rate in patients who are put on ventilators. US patients have shown a recovery of one third of the patients have been shown to have recovery, but it's not being suggested by Indian doctors because the recovery rate is only 1/8 or even less in patients who are put on ventilation. The corticosteroids can be used, but it is not being recommended. Moreover, it has to be administered only at a very lower dose because the corticosteroids stay with the immune function, and it is a double-edged weapon. In some cases, it may be helpful. In some cases, it may not be. But what is very important here is that the application of the paracetamol, azithromycin, also the hydroxychloroquine. Next slide, please. chloroquine or chloroquine is an amine basically, and it is extracted from the cinchona bark. It was synthesized in Germany by Bayer in 1934. It is a versatile antiviral agent. People have been thinking that it is used exclusively for the treatment of malaria, but it is being given for treatment of as an antiviral agent against the um, virus, rabies virus, polio virus, HIV, hepatitis A virus, hepatitis C, influenza A and B, then H5N1, chikungunya, dengue viruses, Zika viruses, and many other viruses, um, um, and also in for treatment of Ebola. The China National Center for Biotechnology Development indicated first show that chloroquine is one of the key drugs very promising in for treatment against the SARS-CoV-5. Chinese authorities suggested that approximately 100 infected patients were treated with chloroquine experienced a more rapid decline in fever, and there is improvement in lung computer tomography imaging and required a short time of recovery compared with the control group. So the Chinese medical survey got initially suggested suggested that chloroquine or hydroxychloroquine may be SARS-CoV-2 treatment and planning. Here, it is recommended, and it also is recommended in US, Italy, and many other European countries. Very recently, and now we will see how, next slide please, how the chloroquine is having its action or mode of action of chloroquine. Chloroquine inhibits the pre-entry step of the viral cycle by interfering with viral particle and its binding to the cellular surface receptor. So just now we have been talking about that chloroquine is the COVID um, 19 virus or the SARS virus goes and attaches to the ACE2 receptor. So next slide, I'll show how it is prevented. Next slide, please. Next slide. COVID can be chloroquine can also impair another early stage of viral replication by interfering with pH-dependent endosome mediated viral entry, and it has got a tremendous capacity to alter the pH-dependent entry of the target cell. Chloroquine can also interfere with the post-translation modifications of viral proteins, and it has also got some immunomodulatory effect, and it suppresses the production of tumor necrosis factor alpha, the interleukin, and thus it has an autophagy action. Next slide, please. Hello. Next slide. Hello.
Sir, next slide is there.
Next slide. Here I have shown how the chloroquine or hydroxychloroquine is producing its effects. You see that it has got um, uh, it prevents the entry of the attachment of the COVID SARS-CoV-2 on the cell surface. It inhibits the coronavirus complex formation with the ACE2 receptor, and also it may interfere with the endosome acidification and viral genome release. And thirdly, act by the NAPK signaling pathway of viral transcription, and it may also affect the protein post-transitional modification and viral assembly, and also it interferes with the budding or the viral budding formation, and also the release of the coronavirus out of the cell. So it prevents the entry, and also it affects the RNA replication, and also it affects the binding of the missile. So because of these three important characteristics of prevention, by preventing the entry and also altering the pH and affecting the transcription, chloroquine and hydroxychloroquine are most common preferred. Hydroxychloroquine is the most preferred one. Next slide, please. Next slide, please. Here also I have seen, you can see that how the coronavirus or SARS virus is entering, and here the process wherever the red line marking is given, that is the chloroquine, the mechanism, the chloroquine interferes with the multiplication. Now to sum up, without going into much of the details about it, the chloroquine or hydroxychloroquine affects the COVID infection by cell surface preventing the cell surface binding, receptor binding, endocytosis of the viral particles, virus transport, virus uncoating, transcription, translation, post-translational modification of viral protein and its assembly, and also it prevents the budding. So that is why the chloroquine or the hydroxychloroquine is prescribed. Hydroxychloroquine is considered as much safer as compared to chloroquine because of many other features, because the toxicity level is relatively less as compared to the chloroquine. And the US and the US doctors prefer treatment with hydroxychloroquine. Here in India also, several doctors suggest use of the hydroxychloroquine, and it is being given, especially in patients who are put on ventilators to prevent the multiplication of the COVID-19 infection. But very important point to be considered is that, like, and a very important point to be considered is that hydroxychloroquine has got some toxic effects, so it should not be used as a prophylactic measure because it has got some cardiotoxic effects. I'm not going into the details. So use of chloroquine and hydroxychloroquine should be done only under the vigilance of the doctor. Next method of treatment is the antiretroviral drugs for COVID-19 therapy. Use of antiretroviral drugs. Now, currently, throughout the world, people are going in for utility of these antiretroviral drugs. They're called as the ARV. There are three major categories of the antiretroviral drugs. Before going into the details of antiretroviral, what is antiretroviral? This means we know that at the beginning I told you that COVID, the retrovirus, or otherwise mRNA containing virus. Viruses are of two types. One is having the mRNA, another one is having DNA. The viruses which are having the mRNA in their genome are classified as the retroviruses. And one important characteristic of this retrovirus is that they always undergo mutation at a very short period of time. So they keep on mutating from generation to generation. And the retroviral viruses are treated using drugs which are called as the antiretroviral drugs. And antiretroviral therapy, very important for treatment of many viral disorders, including um, COVID-19 and also the HIV, etc. So there are three major categories of antiretroviral drugs: nucleoside reverse transcriptase inhibitor (NRTI) or non-nucleoside receptor non-nucleoside transcriptase inhibitor (NNRTI) and protease inhibitor. These are all the major three types of inhibitors. All of them inhibit the transcription of the RNA. We'll see how it is doing that in the next slide. And the other inhibitors are fusion inhibitors, integrase inhibitors, and they are used in the treatment of HIV. And here I have given a list of different types of antiretroviral drugs. That is the nucleoside reverse transcriptase, non-nucleoside, protease inhibitors, fusion inhibitors, etc. In the nucleoside reverse transcriptase inhibitors, you can see the zidovudin, lamivudin, then clavudin, etc., then navirapin, or the non-nucleoside, etc. So these are all the list of drugs that is already available. we in our laboratory at the Dharmani campus have been working on the antiretroviral drugs for several years, maybe running about 4 or 5 years. We have done a lot of research work on this, especially on the toxicological aspects on the liver. And we have produced reasonable publications from that also. We have shown beyond doubt that continuous administration of the antiretroviral drugs are capable of affecting the liver. So, if most of the um, antiretroviral drugs are liver toxic, now we will go into the COVID. Before going into that, we should see how the antiretroviral drugs are producing their effect. Now, the antiretroviral drugs prevent the entry of the viruses into the host cell. So this is called as the entry inhibitor. There are agents that prevent the mutation of the um, uh, mRNA. So these drugs are called as a mutation inhibitors, and the proteases inhibitors are agents which interfere with the activity of the enzyme proteases. Proteases are very important for the synthesis of viral proteins. Right? The viral proteins, I told you, S protein, M protein, like that, surface protein. These proteins should be um, conjoined together to form the viral genome, to form the virus. So these protease inhibitors inhibit the activity of the enzyme proteases, and there are the drugs which are called as integrase inhibitors, which prevents the integration of the viral particles into the genomic nucleus, and there is reverse transcriptase because so this is dependent upon the enzyme RNA dependent RNases. So this RNA is RNA dependent RNA enzyme is being prevented by reverse transcriptase inhibitors. Here I have given you the different points or different locus on which these inhibitors are inhibiting to give a clear idea about how the antiretroviral drugs are inhibited. Remember that they prevent the entry of viruses. Some are preventing the formation of the protein, and they are called as the protease inhibitors. Some interfere with the transcription of the transcription of the RNA. So they are called as the reverse transcriptase inhibitors. They prevent also the integration. They are called as integration, and maturation is also being affected. So different categories. Next slide, please. Next slide. Now here we can see the virus entry preventers, reverse transcriptase, integration prevention. The fourth one is transcription prevention, cleavage prevention, assembly prevention, budding and mutation prevention, and protease. So there are different categories. Here I have given you the picturesque review to show how the um, virus and drugs act on the viruses, especially on the corona type of viruses, HIV1. Next slide, please. Now, antiretroviral drugs and for used for the COVID-19. Basically, they are nucleoside analogs. Nucleoside analogs are derivatives of um, adenine and guanine. Derivatives of adenine and guanine means now you know that any nucleoside or nucleotide is having the four bases adenine, guanine, thymine, and cytosine. And these drugs are simply a modification of the adenine or guanine, thymine, or cytosine. So there is a chemical or structural modification in this. That is why they are called as a nucleoside or nucleotide analog. So they resemble the adenine, guanine, or thymine, and cytosine. And what is very important is that these analogs or these chemicals are um, behaving similarly like the adenine and guanine, and they go and interfere with the adenine and guanine, and they form the block the DNA dependent RNases, and also they change the configuration of the RNA in the viruses and prevent and the structural of the RNA viruses. So this is why they are called as a nucleoside analog, and they act upon the nucleoside. Several nucleoside analogs are there. Very recently, few days back, maybe previous, uh, Tiravir is the drug which has been approved by Government of India for use in the treatment of COVID-19. The drug Favipiravir was discovered by Toyama Chemicals of Japan, and it is a modified tyrosine analog, and it is initially approved for therapeutic use in the resistant cases of influenza. It is now shown that the Favipiravir is a pyrrolidine amide, and it has an activity against RNA viruses, and it is converted into ribofuranosynctyl triphosphate derivative. Now we should remember that most of the retroviral drugs are not really drugs. Very strictly speaking, they are not really drugs. A drug means it should straight away produce an effect when it is given. But actually, drugs are called as a prodrug. That means they does not act as a drug, but they are called as a prodrug. They get activated only when they enter into the system and get phosphorylated or undergo some chemical reaction. So when these chemical reactions are happening, a prodrug is really converted into a active drug or the prodrug or the drug. So most of the retroviral drugs, remember, are the prodrugs. So the riboconazole uh, triphosphate is actually a derivative of favipiravir, and it is the active form of drug which interact with the DNA-dependent RNA polymerase enzyme, which is necessary for the transcription and replication of the viral genome, and it inhibits the growth of influenza virus like yellow fever, chikungunya, Ebola, and enteroviruses. Scientists have reported its effectiveness against 2019 Gen4 very recent. COVID-19 infected patients, various clinical trials globally are recommended for the treatment of mild to moderate. Next slide, please. Right. And this is the chemical structure of the drug. And now it is being marketed in India. It has been approved by the Indian Drug Controller General of India, launched as a product in India on Saturday, that is on 19th 2000, and it is priced at 3,500 rupees for a pack of 34 tablets. Costly, and it is this dosage is around 200 milligram into 9 tablets for the day one, and then 400 milligram or 200 milligram tablets 4 times a day for 14 days, and it is suggested for the mild and moderate infection type of COVID, because at this point of growth, at this point of time, that is a mild and moderate time, activity of the virus is more. So preventing the replication of virus is very important at this stage. So now the doctors suggest, the government of India and the ICMR is now suggesting the application of this. Glenmark is a company that is being authorized by government of India for production sales of this, and it has been used in 11 cities across India, and it has shown that nearly 80 to 90, 80% of success in treatment. So it is repeated dose, but one thing is that it's repeated dose administration for a very long time has been shown to produce liver toxicity in dogs, rats, monkeys. It affects the hematopoietic, it causes reduction of the RBC, and it also produces uh, toxicity of the test. But no report of toxicity reported human, and it is because the trials are still incomplete. However, because of its efficacy, this drug, favipiravir, is now being recommended. The next one is the remdesivir, furosemide drug, and it is an adenine derivative approved inhibitor of HIV reverse transcriptase. This drug was initially used for the treatment of HIV, and remdesivir is a broad spectrum antiretroviral activity, and it is being used in lot of the coronavirus infection, including human COVA and zoonotic bacterial COV and pre-pandemic zoonotic COVS, and additionally it is being used in Ebola, cell cultures, and animal models. And latest studies have suggested that the remdesivir can inhibit in 2019 nCoV. And now the phase 3 clinical trials of remdesivir is being of COVID-19 was launched in Wuhan on February 4, 2020. Remdesivir is not expected to be widely available as an experimental drug for treatment uh, treating a vast number of patients. Now it is in an experimental stage of development, but the FDA has approved the use of remdesivir as an effective COVID-19 treatment. And now it is recommended for the patients worldwide also. It is now also used in India. Next slide, please. Now how the antiretroviral drug is acting remdesivir is again it is interfering. The chemical structure is given. Remdesivir is a broad spectrum antiretroviral drug, and it interferes with the RNA polymerase enzyme, and it helps to copy the genetic material, and it acts as a viral against the viral replication. It prevents the viral replication by inhibiting the RNA-dependent RNA polymerase enzyme. Next slide, please. This is with respect to the antiretroviral drugs as far as this one. Next important series is the protease inhibitors. The protease inhibitors are the enzymes which inhibits the proteases. And there are several drugs available under this category. I'm just giving a bit about chymotrypsin-like and terpine-like protease inhibitors. These inhibitors, which are called as free proteases, or the non-structural act on the non-structural protein part, and they play a critical role in the replication of coronavirus, and can also inhibit the innate immune response. And they are being not used effectively for SARS-CoV. They are being just suggested, and testings are under progress now. Next one is lopavir and ritonavir, and they are primarily supporting chymotrypsin-like proteases in the SARS virus and also in the MERS virus. They have been tested effectively in these SARS viruses, but regarding the COVID infection, it has not been tested. It suggests that combination of and ritonavir is not effective in treating the severe COVID-19. That is why it is not being recommended. But however, the reports respect to this and further research is needed on this aspect. And remdesivir, it is again a protease inhibitor that is used as an anti-hepatitis C virus infection. It interferes with the viral replication and suppresses the effect of viruses on the host response to viral infection. And it has been tried in a very small clinical trial for about 4 to 12 days. It has been shown to be effective against SARS-CoV-2, but not recommended for use by drug certifying authorities. So, whenever there is still under experimentation or experimental conditions. To sum up or brief up, the protease inhibitors, though they have some antiretroviral activity, they are not being recommended or not being put into like this. Well, just now in the beginning of my lecture, I was telling about a lot of the production of the immune responses, especially in the lung. So these immune responses start producing lot of the inflammatory mediators, which are called as a very called as a cytokines, right? These cytokines are capable of killing the cells itself, and they produce a lot of unwanted side effects, and that is a major complication in the treatment of coronavirus. Cytokine storm is a very well proven phenomenon in the COVID infection. That means in this cytochrome, what is cytokine storm? Cytokine storm or cytokine release syndrome is a result of widespread release of pro-inflammatory cytokines following the activation of immune system by the microorganism. So the cytokine storm happens because of the imbalance in the immune system, or it is actually the activation of the immune system. So the SARS-CoV virus and in ME or virus infection, there is overproduction of pro-inflammatory mediators. That is, lots of inflammatory mediators or cytokines such as IL-6, that is interleukin 6, IL-1, IL-1 beta, IL-12, IL-18, IL-33, interferon alpha, interferon gamma, and CNS, that is tumor necrosis factor alpha, or cytokine, and the chemokine, and the C motif ligand 2, that is CCL2, CCL3, CCL5, CXP motif. All of them are different types of cytokines, and they are being flooded in the lung. So that produces a lot of infection, and a lot of complications or infection. So COVID-19 reduces the production of inflammatory cytokines like IL-6, and the release of IL-6 and a few more cytokines are by the monocytes are important for this one. The cytokine storm is also the fundamental cause of COVID-19. And next slide, please. This cytokine storm can be modulated by the use of the monoclonal antibodies by the immunomodulation approach. Several the anti-IL-6 inhibitory agents like tocilizumab, MAP, and MAP, and etc. are being tried in COVID infected patients. They inhibit the IL family and interferon cytokines, etc. But their use is not being tested under a testing condition. Next slide, please. Next slide, please. Uh, Very recently, the plasma therapy or conventional plasma therapy is being recommended because the plasma of already infected patients who have been cured contains a lot of passive antibodies. So these are called as the covalent plasma. The plasma antibodies contribute to the elimination of the infection by a direct binding to the pathogen, neutralizing them. So in COVID-19 patients, their plasma contains active specific antibodies, and the hyperimmunity and the immunoglobulin therapy or the convalescent plasma therapy is a positive adaptive immunotherapy that is being recommended. In India, plasma therapy is used. To put it simply, the plasma of the person who has been already infected by COVID-19 is being taken, and it is being administered to severely plasma infected patients under clinical conditions and trial. It has shown to be effective in treatment of the diseases, and it is also it has been shown to improve immunological function of the affected individuals. So plasma therapy is now being recommended. Even the Delhi administration has recently recommended the plasma therapy. Even in Chennai also, plasma therapy is recommended, especially if it is being administered, recommended. Um, and testing is being approved for the highly critical patients who are in the verge of collapse, especially the lung functions and the people who are put on ventilators are being tried on people who are going to be put on ventilators or being recommended for treatment by the plasma therapy. Therefore, the convalescent plasma is employed as a rapid immune-based therapy. Early stages of the disease increase the infected patient's immunity against the virus and to stop the COVID progression and enhance the therapeutic success rate. Vaccination is another important stage. There are five different approaches: inactivated vaccine synthesis, recombinant vaccine, subunit vaccine, DNA and mRNA vaccine, attenuated vaccine. Next slide, please. Inactive vaccine. Next slide. Inactive vaccine, virus is a vaccine, is also known as the whole killed virus. The viruses are inactivated and by preparing a neutralized by neutralizing the pathogen as a whole by chemicals or by heat treatment or by radiation. These inactivated waste vaccine has been tested in the rhesus monkeys with the formaldehyde as a formaldehyde. The formaldehyde inactivated the COVID SARS-CoV vaccines have been shown to be very safe and they produce immunological they boost the immunity, but they have not been tested in the human. However, the efficacy for the vaccines in human is yet to be reported. These data suggest that the WKC vaccines are safe. We are able to induce for to 205 specific neutralizing antibodies to inactive the viral could also be evaluated in the potential of vaccine treatment. Next slide, please. Next slide. So recombinant vector vaccines, these are defined by defined as a live derived viruses that are genetically manipulated and harbor critical pathogens coding. Recombinant vector vaccines are highly effective in triggering the immune response. The viral protein, such as the vaccine, can act as an adjuvant. The adenoviruses, modified vaccine viruses of Ankara, are the two most important viral vectors now being used and they are being developed for SARS-CoV virus and RS-CoV virus vaccine. These vaccines are still in the testing condition. They are not implemented. But the vaccine development has been reported by several countries, but their efficacy and their utility is not being tested properly. Next slide, please. The subunit virus vaccines, they are considered as safe because they are they constitute only a very small portion of the mRNA fractions. The subunit vaccine production for COVID-19 is under testing conditions. In addition to the vaccines are less prone to generate side effects. That is why the subunit vaccines preferred, uh, are being preferred. As I told just now, they are only in the testing condition. Next slide, please. mRNA vaccines, they are being developed as a protein-based vaccine required for the growth of viruses and its protein purification. So here a part of the virus, the mRNA, being taken and it is being used as a agent for the immune development. mRNA vaccines are considered as safe or safer than inactivated. And the huge benefit of mRNA vaccine is that it can circumvent the hassles associated with the purification of viral proteins. And the mRNA vaccines are um, under testing conditions. Different countries have made this approach. Next slide. Now here, this vaccine development is under production stage. The vaccines are being developed for the whole viruses and also for particular sequence of nucleic acid or using a viral vector, or the vaccines are also developed using the protein-based substances. All of them are with the basic objective of enhancing the immune responses. But remember, the development of the vaccine under testing conditions now, and there is no report about the vaccine development, successful vaccine development, and it may take another 1 year or 2 years or even more for a successful development of vaccine. So this is only in a testing condition. Next slide, please. Slide. The last approach is the herbal and traditional remedies approach. In Chinese medicine, even when in the Wuhan district, the Chinese coronavirus was being treated by application of lot of herbal remedies. They have not revealed about this in the publicly, but there are reports that the disease got cured by application of locally available herbal medical preparations. The most noted one of this is the glycerin, which is an active component, and it is being extracted from the fruits of Chinese medicine, and it is effectively inhibit replication not associated with COV in vital studies. Further, high doses of glycerin have been used in clinical trials as a compound has been reported to be clinically very effective in heart medicine. Recently, glycerin has been predicted to have the ability to bind to ACE2 and bind the ACE2 receptor. So we know that any drug that is inhibiting AC is a very good candidate for. So the Chinese medicine, glycerin is being tried. Next one is the hesperidin, and it is a well-known traditional Chinese medicine. It is a natural dominant flavonoid, and it has been tested in cell cultures of the SARS-CoV-virus, and it has been shown that this drug also has got a potential to inhibit ACE2 receptors and thereby block the infection of SARS-CoV-2. The third important one is the quercetin. Quercetin is a normally available plant flavonoid, and it is widely used in traditional medicine. And it has been shown to inhibit the inflammatory mediator CCL4, very commonly available in the SARS-CoV infection. Therefore, the study suggests that Chinese medicine plays a very important role in prevention of the COVID viruses. Next slide, please. In India, the use of the herbal and traditional medicine was used, especially the Kabasura Kudinir and Kambasura Kudinir has been recommended. People have tested it for their coronavirus diseases, and in silico experimentation has been done, and effectively the state and the director of Indian medicine has come out with a very good presentation of this aspect, and they have shown that the traditional medicine of India very effective in preventing the migration. But this is a in silico experimentation only. This Kambasura Kudinir has got 15 different types of treatment. Of course, you would have heard about this. So, the Chikku, then the Ada Toda, and various other the Foray Kalvi, etc. Different types of their botanical name or their active principles in retinol and piperin, etc. All of them are combined together and they are acting as a very good agent for prevention of disease. Next one is their testing. They've been tested for the target protein of CO5 spike protein and coronavirus spike protein combination. We know that is the spike protein which is responsible for. In the protein ligand docking studies have shown that rough docking experiments were performed, and they concluded that the study demonstrated that the Kabasura has got very effective against COVID-19 infection. The phytochemical shows promising activity against viral spike glycoprotein, and some more effectiveness of the phytochemicals are also present. And furthermore, preclinical clinical pharmacological studies are being recommended. Now, the Chennai Corporation has started distributing the the Kabasura to the local population at free of cost, especially in people who are the red alert area, and people are using it as a preventive measure. Now, these are all the chemical structures which are present, or very active ingredients that are supposed to be having very good docking effect and preventing effect. Next slide, please. Here the herbal remedy, this I have already shown the template. Now, this is another investigation which is an in silico computational screening of carboxylic an official SIGA formulation. Again, again, this is a doc study. It has been conducted in the SIGA Research Institute of Chennai and also by the Ayush of the Department of Biotechnology. And next slide, please. Now, without going into the detail, I just show you a clipping showing that in the Indian Express, 30 COVID-19 patients are discharged from SIGA treatment in Chennai. So this is a very recent news which came on 12th June. This shows that the Indian traditional medicine is being put into use for COVID treatment and this is having some effectiveness. There are a lot of SIGA treatment reports, but the details are not being prominently told. Very recently, 2 days back, it has been reported that there are the Indian system of medicine, especially SIDA, has developed three important formulations, and they are the people they were able to treat 100 patients. Next slide. So India to test the four Ayurvedic drugs for COVID within a week. So this is information from the Ayush is going to test for four Ayurvedic principles. So traditional Indian medicine is also very effective in treatment against. Next slide, please. However, it may be, prevention is better than cure. So COVID-2 viruses highly contagious, and so the best solution for controlling the pandemic will be the simultaneous application of preventive methods, sensitive diagnostic approaches, and approaches. Earlier, when the disease was spreading, mathematical models were examined to test whether the control of SARS-CoV infection could be achieved by isolating the affected patients and tracking their contacts, etc. But this model concluded later that isolating people and reviewing their contacts would be insufficient to control COVID-19 within 3 months because there would be too much delay between the onset of symptoms and isolation. Now, this is what the situation happens. There is a gap in between the identifying the gap, contact. And of course, there are many untoward, unwanted incidences happen in the establishment of contacts, and the people were not being um, um, that much aware about those aspects. So there was some frustration among the people. But now, because of the education and also the understanding of the security, given some um, input to the minds of the people, especially Chennai and around India. But now people have started realizing that preventive measures is better. Next slide. So prevention by isolation, lockdown would be recommended. So it is possible to minimize the spread of infection by making the following recommendations, which is being recommended by the WHO. Next, first one is staying at home or home quarantine. Avoid any direct contact with any healthy, possibly the asymptomatic patients or infected patients. This process is called as a shielding. Avoiding non-essential travel, so unwanted roaming should be prevented. Observing social distancing rules like avoiding crowded public places and maintaining the at least 2 meters distance between each person, especially if they are talking. Avoid handshaking um, and the greeting. Frequent washing of hands recommended at least for 30 seconds or use hand sanitizers, avoid touching eyes, nose, and mouth, and washing the hands with disinfectants, etc. And keeping the house clean with sprays. So, with this, next slide, please. Thank you all for patient listening of my lecture, and I hope that the, um, my mission, giving some information and to the audience is fulfilled. Thank you for your patience.
Hey, Dr. Karthikeyan sir.
Yes, sir.
Yeah. So it's a very wonderful presentation and very informative. And this is the kind of presentation which is the need of the hour in the current COVID-19 pandemic situation. You have collected so much of information, and I am sure all the participants enjoyed and your lecture with so much information. And there are a few questions uh, raised
Most
by.
welcome, sir. Anybody is interested, let them ask. Let them free to ask few more questions. Right? I think I have not taken up too much because the next speaker should not be in trouble, and we should not be running out of time. So
Okay, okay, okay. So,
you can give them the phone number also. One or two questions is most.
okay.
Otherwise, you can ask me. You can ask me if you have any questions to be.
No, 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 no. Okay, okay. Only one thing is Dr. Sounder from Delaware. He has
Yes,
put a
yes.
message that he liked this wonderful presentation. It was very informative. On behalf of the host and Dr. Sounder, he wanted to thank you.
Okay, thank you. Thank you, sir. If you are listening there, I don't know whether you are there online.
Yeah, he is
Otherwise,
there. He's there.
okay. Thank
Yeah.
you, Sounder. It is because of you that I got in contact with Dr. Ramesh. And thank you for giving me a wonderful opportunity to share my ideas. I think we should reach globally so that everybody who is interested in COVID may be learning more about this. I have collected a lot of information and put it in my simple form for the reach of the students as well as for the general public. Thank
Okay,
you,
okay,
Dr. Sounder.
okay. Okay, doctor. Maybe you can give your email so that if anybody is raising questions, so I'll ask them to contact through email to you.
Okay,
Is that
okay. You
okay?
can just, yeah, it is okay, sir. You give my email as well as phone number. I'll be very much happy to be to answer these their queries and doubts, etc. Right?
Okay, sir. Very very nice
My
of you.
lecture, I think it is somewhat very informative for beginners as well as for all the. Right, sir?
Yes, sir. Sure, sir. So on behalf of Bharat University and the as a convener of this meeting, I wholeheartedly thank your wonderful presentation, sir. Thank you. Thank you very much. Bye.
Thank you, sir. Thank you.
Bye, sir.